In adult patients infected with HIV, neuroinflammation interferes with normal synaptic signaling, leading to neurocognitive deficits that include difficulties with abstraction, verbal fluency, attention, learning new information, and memory. HIV-1 TAT induces the secretion of inflammatory molecules, which can mimic the synaptic dysfunction seen in patients with HIV. Here, adult mice expressing GFP in mononuclear cells, including microglia, are used to investigate HIV-1 TAT-induced neuroinflammation. Using thin skull two-photon microscopy, the responses of microglia following injection of TAT can be imaged in vivo. The resulting images demonstrate shortening and thickening of microglial processes and the formation of phagocytic cup-like structures, as well as peripheral monocyte trafficking in cerebral microvessels.
Hi, I'm Dan Marker from the lab of Harris Gelbard in the Center for Neural Development and Disease at the University of Rochester.
Hi, I'm Marie-Ève Tremblay from the laboratory of Ania Majeska in the Department of Neurobiology and Anatomy at the University of Rochester.
Hi, I'm Xiaoming Lu, also from Gelbard's lab.
Today we will show you a procedure for two-photon imaging using a thin skull preparation.
We use this procedure to study chronic neuroinflammation.
So, let's get started.
In the experiment shown here, mice that express GFP in mononuclear cell lineages, including microglia, are used. Different strains of mice can be used to meet the needs of a specific project. Begin preparing a fentanyl midazolam medetomidine anesthetized mouse for surgery. First, ensure that the animal no longer responds to painful stimuli such as a tail pinch. Place the animal on a heating pad to prevent post-anesthesia hypothermia. Then cover the animal's eyes with a protective ophthalmic ointment to keep the eyes moist. All surgical instruments should have been autoclaved or sterilized with a glass bead sterilizer. Further disinfect the instruments by soaking them in 70% ethanol. Using scissors, remove the hair from the animal's scalp. Then, disinfect the area using a 10% povidone iodine solution and 70% ethanol. Begin the surgery using small scissors to make a midline incision in the scalp, starting 4 to 5 mm caudal to the skull and advancing forward to the front of the eyes. This incision should be long enough that the skin will not interfere with the gluing of the plate that stabilizes the mouse head during two-photon imaging. Next, apply 100% ethanol with a sterile cotton swab to dry the membranes on top of the skull. Scrape them away using fine tweezers. If the membranes are not removed, the head plate attachment will be unstable. Under a dissecting scope, identify the area to be thinned. Avoid areas of interest directly located over cranial sutures, as the skull is less stable in these areas, and underlying large vessels and meninges will interfere with imaging. Center the viewing window on the area of interest. Then, again using a cotton swab, dry the skull again using a 10% solution of ferric chloride. Place a thin layer of the Permabond 910 glue around the edges of the viewing window underneath the head plate. Then place the plate over the area of interest on the animal's skull with light pressure. To bond the glue, apply a small amount of acrylate around the edge of the viewing window using a syringe. Finally, apply a small amount of Loctite 454 to the edges of the viewing window to prevent leaks. Screw the head plate to the animal holder and check the stability under a dissection microscope by lightly probing with a pair of forceps. There should be no movement of the skull relative to the head plate. Place a drop of saline on the viewing window to ensure that there are no leaks. In preparation for thinning, dry the skull using a combination of sterile cotton swabs and compressed air. Thin the skull using an IRF 007 drill bit in a microtorque 2 drill at 4000 RPM. Very gently, begin thinning a 2 to 2.5 mm diameter circular area. Use only light sweeping motions nearly parallel to the skull. Do not use direct downward pressure. Stop drilling every 20 to 30 seconds to remove bone dust using the compressed air. These breaks in drilling allow the skull to cool so that there is no heat-induced damage to the underlying brain tissue. As the drilling progresses, notice the transition to the moister spongy bone layer called the diploe. Once this layer is reached, exercise extra caution with the drill. Occasionally check the thinness of the skull by placing saline over the thinned area and viewing under the dissecting scope. Saline will further enable heat dissipation. As the skull is thinned, smaller vasculature becomes visible. Use a dental microblade to achieve the final thinning under saline. The microblade provides much more tactile feedback about the stability of the skull. This allows for much thinner preparations than with the drill alone. The optimal skull thickness for imaging is 10 to 30 micrometers. The entire thinning process normally takes between 15 and 30 minutes. Check the thinness of the skull under epifluorescence multiple times while making a thin skull window. The sharpness and depth of visible microglia and vasculature give a good indication as to when the window is ready for imaging. Once the window is ready, use a 1 mm diameter glass pipette to place a small drop of cyanocrylate glue onto the thin skull area and carefully lower a piece of cover glass onto it. Then press gently against the skull to squeeze out any excess glue, avoiding bubble formation between it and the cover glass, which may obstruct the view. Once dry, use a microblade to carefully remove any glue left on top of the cover glass. In preparation for two-photon imaging, cover the thin skull cortical window with saline and locate the area of interest under epifluorescence. To enable subsequent imaging of the area, take a picture using a photographic camera. For imaging shown here, a custom-made two-photon microscope with a TI sapphire laser tuned to 920 nanometers is used. Fluorescence is detected by using a photomultiplier tube, or PMT, in whole field detection mode and a 580-180 emission filter. A 20x water immersion lens is used throughout the imaging session. Set the maximum output of the laser power of the objective between 50 and 65 milliwatts. Next, select an area of interest in either cortical layer 1 or 2, up to 150 micrometers below the peel surface. To facilitate re-imaging, take pictures of the same field of view at 1x, 2x, and 3x digital zoom. Blood vessels can serve as landmarks to easily find the same field of view during subsequent imaging sessions. Under a zoom of 3x, acquire multiple z-stacks with 80 to 90 z-steps each and a 0.69 micrometer step every 5 minutes for up to 30 minutes. This enables a good sampling of microglial morphology and behavior over time. Between acquisitions of z-stacks, verify the level of saline and the depth of anesthesia. If necessary, a booster dose of 1/3 of the original dose of anesthetic cocktail can be given during the procedure. To prevent tat deposition onto the syringe and needle during the injection, days before injection, silanize the inner lining of a 35 gauge needle and 10 microliter microvolume syringe by withdrawing silanizing solution until it fills both the needle and syringe. Allow the solution to sit for 5 minutes at room temperature. Then empty the solution from the syringe, remove the plunger, and allow the syringe and needle to completely dry. Finally, wash the syringe and needle thoroughly with deionized water. Once silanized, a syringe and needle can be used for more than 6 months before a recoating is necessary. On the day of injection, place a small drop of the TAT solution on a silanized glass slide using a siliconized pipette tip. Load the desired amount of solution into the microvolume syringe from this drop. Using a drill bit, perform a small craniotomy 0.5 mm in diameter, either 3 mm rostral or lateral, to the thin skull cortical window where two-photon images have been obtained. To accomplish this, carefully thin the skull. Then use a sharp pair of forceps to remove the thinned layer of bone. Use a micromanipulator to line up the silanized 35-gauge needle and syringe with the craniotomy. Then, carefully advance the needle to a depth of 700 to 900 micrometers below the peel surface. Deliver 3 microliters at 80 nanoliters per minute using a microprocessor-controlled syringe pump. This figure shows GFP-labeled microglia visualized with two-photon imaging after implantation of the thin skull cortical window approximately 50 micrometers below the peel surface. The single two-photon sections taken on day 0, 15 to 30 minutes after implantation of the thin skull cortical window, as well as those taken 7 and 17 days later, demonstrate that the windows stay clear while microglia remain inactivated in the absence of inflammatory insults. This highlights the utility of this method for investigating both normal and inflammatory interactions between immune effector cells and other neural cell types in vivo. The Z projections taken at 6 and 24 hours post-injection of the HIV neurotoxin TAT exhibit marked morphologic changes of activated microglia, further demonstrating our ability to study morphologic changes of microglia in real time in acute and chronic models of neuroinflammation.
We've just shown you how to prepare a thin skull window and use it to study neuroinflammation.
When doing this procedure, it's important to remember to take your time when thinning the skull to prevent any damage caused by the preparation itself.
So that's it. Thanks for watching and good luck with your experiments.